I want to be mindful of everybody's time, and I want to thank you all for coming out this evening. For those of you who may not know me, my name is Monica Gallant, and I'm the Director of Prevention Services here at the Boys and Girls Club. I am also the Director of the Community Action for Safe Teens Coalition, which is a committee of the Boys and Girls Club of Souhegan Valley. And our mission is to prevent substance misuse in the Souhegan Valley, to promote healthy choices and emotional wellness among youth, and educate and support and strengthen families. Couple of logistics I want you to be aware of before we get started is when you are in the common areas, such as the lobby, or if you head out to the restroom, if you could please wear your mask. That is a club policy. You are free to take them off while you're in your seats, and we ask that you be seated at least 2 seats from someone that you're not related to. And our restrooms are located right outside these doors over here to the right. And I also want to let you know that this presentation is being recorded this evening, so we will be sharing this link with some people that could not be here with us tonight. So I want to tell you a little bit about our CAST Youth Empowerment and Service team. They are a group of middle and high schoolers who have been talking about mental health issues for a long time, and it is a major concern of theirs. They've been working on messaging that will be shared on our social media, and in your folders, you have a card that was actually created by Joshua, who is one of our panelists tonight. They are really reducing or eliminating stigma is really important to them, and they want people to know that it's okay to reach out for help. So before I introduce our moderator for tonight, we have another guest who participated in the Magnified Voices Expressive Arts Contest. And this contest is open to middle and high school students, and they were invited to submit creative pieces about their experiences with mental health in New Hampshire. This evening, we have a young person from Goffstown High School who graciously offered to share their piece with us, and at this time, I'd like you to welcome Ozzy to the stage.
Hi everyone, I'm Ozzy, and I submitted a piece for Magnified Voices, and my piece is relating to obsessive-compulsive disorder, shortly known as OCD. So with OCD, the thing about it is you need to control something, and for me, it's washing my hands a lot. So I feel like I'm in control of things when they're clean, not necessarily tidy, but clean, and I just like washing my hands, and it makes me feel a sense of relief that the anxiety from obsessive-compulsive disorder causes. And I'm very grateful to be here tonight talking. It's a really cool thing. I've never done Magnified Voices before. This is my first time submitting an entry. I'll definitely be doing it again next year. But yeah, my piece, it's in front. Yeah. Oh, I placed in the top 10 for Magnified Voices, the contest, and yeah, that's it. Yeah.
The top 10 get a $250 check. So she's the recipient of that.
That's nice. That's awesome. And you really have to take a look at their piece because it's very powerful. I took a picture of it to share with my kids when I get home. So I just want to remind everybody of the topic tonight. So this forum or community conversation is a youth-led conversation, and it's about mental health. And when we were asked or approached by Delhi to collaborate on this project, we were really excited because, as I said, our youth have been working on mental health issues and working on raising awareness about it for a long time. So it's really exciting to be able to bring it to you and people that are watching via our webinar. So we do have one person that was going to be with us tonight that is unable to, and it's Officer Will Morrow. He is our juvenile officer here in Milford, New Hampshire, and he has a really amazing testimony as well, and I will send that out along with the webinar recording because he is unable to share it with us himself tonight. So now I will introduce our moderator, and Abby Forens is our longtime cast member. Abby joined the Youth Coalition in 8th grade and has been a very active member ever since. And Abby just completed her freshman year at Wheaton College. She's studying political science. And much of Abby's time when she's home is in New Hampshire is spent here at the club as a youth mentor. She's been wonderful with our young people and adults too. She helps us a lot. And she is, in addition to being a youth mentor, she's a strong advocate for mental health of young people. So we really love to have her with us. Abby was also the New Hampshire State Youth of the Year for Boys and Girls Clubs in 2020. And she represented the Souhegan Valley Boys and Girls Club. So please welcome Abby.
Hi, 1 second. Okay. Hi, I'm Abby. So I will be the moderator for this evening, so any questions that y'all will end up fielding, I will be facilitating. So our objective this evening is to raise awareness about mental health issues that young people and families are experiencing. We'll be talking about what our panelists are seeing and experiencing and what we think the supports they need are. So before we kind of kick off, I just wanted to take a moment to share a more personal level to why I feel like this is a really important conversation to have. I wanted to share my gratitude for this conversation and all of those involved, both attending online and here. As a young person, I've seen many of my friends and peers battle addiction, take their own lives, and not be granted the support that they so gravely needed. I, along with so many others, have felt the struggles associated with mental health amplified by the COVID-19 pandemic. Therefore, the topics and problems and solutions that we'll be discussing this evening are more imminent than ever. I've also worked with the CAST Coalition since 8th grade, and now I'm a freshman in college, and throughout all of those years, there's one thing that has rung true. There's a need for folks, especially in positions of power, to listen to young people. And young people, we do have a voice. And we'll use this conversation as a point to continue to provide a platform for youth to share their experiences. And thank you all of us for joining and really, truly listening. And thank you to the folks on this panel for being so brave and candid with your stories. So, before I begin, we're going to be introducing each panelist, and I'll call on them, and they will share just a really quick, hi, who am I? And possibly their agency and what they're doing to address the issues we're dealing with and talking about here. And as Monica mentioned before, the audience you will be invited to ask questions, which we will be fielding at the end. And you have index cards in your folders. So if you have a question, write it down. I think there's a pencil in there as well, so you can hold up the index card and someone will come grab it and eventually bring it up to me. And when that time comes, I can come ask these questions. So we're going to introduce our folks first. So I'm going to call on Mia to go introduce yourself.
Hi, everybody. Thank you all for coming. I'm Mia Flegel. I'm a freshman at Nashua High School North.
Awesome. Kaylani?
Hello, I'm Kaylani. I'm a freshman at Milford High School, and I'm also part of the CAST team.
Josh?
Hello, my name is Joshua Cho. I'm an 11th grader at Souhegan High School, and I'm also a member of the CAST TS team.
Awesome. Oakley?
Hi, I'm Oakley Bazemore. I am a sophomore at Hollis Brookline High School, and I am also the youngest chairwoman on the Hannah Grace Bazemore Foundation.
Awesome. Jason?
Hi, my name is Jason Bazemore. I have 3 children in the Hollis Brookline school system, and I am the co-founder of the Hannah Grace Bazemore Foundation.
Awesome. Shilu?
Hi, my name is Shilu Joshi Flegel. I'm a clinical social worker. I'm at Souhegan High School. And beyond that, I'm also the parent of this amazing child.
Molly?
Hi, I'm Molly White. I'm from the New Hampshire Department of Education. There I serve as an Mtssb consultant for the Southwest region of New Hampshire.
Awesome, Deli.
Hi, I'm Deli Champagne, and I'm a Community Engagement Coordinator at New Futures. New Futures is a healthcare policy and advocacy organization in Concord.
Awesome. So all of these wonderful folks on our panel have a lot of incredible and powerful things to share. A couple of us have stories that are going to kind of kick us off. So I'm going to call on Mia to share your story first.
So just a reminder, I'm Mia Flegel. I'm a freshman at North. First, I wanted to thank all of you for being here and listening to all of our stories and being open to hearing youth voices discuss mental health. This truly is an amazing opportunity for me to be here today and be able to have a voice to share my story. I started talking about my mental health journey about 2 years ago when I submitted a writing piece in the Magnify Voices contest. I also ended up in the top 10 and was then chosen to read and share my story at the summit along with 9 other youth voices. If you're here in person, my writing piece is actually right back there with the big airplane thing on it, so if you want to take a look at that, that's what I submitted. That opportunity just really helped me grow and be a lot more comfortable in sharing about my anxiety journey because it really let me know that I wasn't alone. During that same year, I went to another function at Franklin Pierce University where I was the only youth voice at the forum, but despite that, the support and acceptance amongst other adults was also a really great experience. One last quick thing is a huge thank you to Ms. Champagne, who was the one who gave me all of these opportunities, including this one, and of course for believing in me and my ability to speak up.
Awesome. Okay. I love that. Kehlani, would you like to share your story?
Well, when I was a kid, I had to overcome many obstacles. Me and my mom were homeless for 10 years. My mom struggled from addiction, and I was constantly in unhealthy environments. And I was surrounded by a lot of toxic people. Many of them also struggled from drug addictions, and a lot of them were abusive. I had to deal with the stress of not knowing where I would sleep the next night. And when my sister was born, I had to worry about keeping her and my mother safe. From my experiences, I've learned that mental health truly does matter and it can impact you tremendously. At times I felt hopeless and like things would never change or get better. And depressed when what I went through was tough and I always was too shy and anxious to reach out for help. I would bottle up my emotions, and when things became overwhelming, I would shut down and hide no matter where I was, because that's all I knew what to do, is not talk, and it felt safer that way. I tried it, and when I tried, it almost felt impossible to talk. When I turned 11, I was given the opportunity to move in with my grant in a safer, more stable home, and after a lot of thought, I did. On my journey, I have had so many people and programs that have helped me along the way and helped me improve and made me into the person I am today. To them, I am forever grateful. They showed me how reaching out and using my voice can help not just me, but others as well. Although I am still anxious and timid to speak, I still try my best each and every day to improve. I never knew how much the things I bottled up affected me until I started to let them out and heal, which is why I'm here today to spread the word about mental health and try to help our community, because a lot of people are experiencing unhealthy mental health issues and need support and help, and to help them right now.
Awesome. Thank you. Joshua?
Good evening. Today, I would like to share with all of you my personal testimony of revival and healing. Early on in my life, my identity was built on the world's definition of success, that your value is measured by your wealth, your level of intelligence, or your appearance. Moreover, as an Asian American, I was often in the minority, and it resulted in a greater desire to be successful. I remember the stress I often felt because I felt the need to achieve academically in order to be acknowledged. For some time, forcing myself to bear with the stress did give me the results I wanted, but all the while I was suffering. My identity came from my academics and worldly success. I also became arrogant and prideful, thinking that I had more value than others. It came to a point where I dreaded going to school, and I had trouble making strong connections with my peers. As I grew older, I became even more burdened because I was no longer able to get the results I wanted, and I had failed to meet the expectations for myself in my academics. I became overwhelmed with stress, and I also became depressed. This school year, I had to drop a class because I struggled to follow the pace of the course, and I became so burdened with my academic failures. Placing my identity in worldly success led to a sense of hopelessness because of my failures. I also had many wrong decisions, and my life became a cycle of sin. Life had no meaning for me, and I felt no reason to live. I'd been living like this for a year until around the end of August 2020, where I accepted Jesus Christ into my life again. I truly believe that it is God's grace through faith that is my source of hope. The life I lived for myself was hopeless, but I now live with hope in my life. I'm weak and I'm not enough, but that is fine with me because my identity is no longer in how rich I am or how smart I am or how I look. My identity is in Christ, and I am a beloved child of God. The life I now live is filled with faith, hope, and love. I'm more thankful for the blessings in my life, and there is joy. Also, I experienced miracles in my life, and I can say that my school year has been the best of my 17 years. Though I no longer place my identity in my success academically, my grades have not fallen, and my test scores have improved more than what I have expected. Though the last year has been a great challenge for me, I truly believe that it is also a turning point for the better in my life. Thank you.
Awesome. Oakley?
Hi, I'm Oakley Bazemore, as you guys know, as I said earlier. But sometimes, especially in contexts like this, I like to call myself an amalgamation of a mess. Jokingly, of course. For the past 5, 6, I don't know, time goes over my head nowadays. But for many years, I've struggled with not just some mental illnesses, but a lot. I deal with anxiety, I deal with major depressive disorder, I have OCD, I have ADHD, I have PTSD, and on top of that, as some of you guys probably noticed, I do have tics. No, not the bug. I mean like Tourette's type of tics, except it's not Tourette's, but it's easier to say because nobody really knows about what type of tics I have. And honestly, that just goes to show how much more awareness we need, but you know. I've lived a really tough life, in all honesty. Nowadays, I'm a very happy person, but for the longest time, I was not. I am both a survivor and a victim. I am a survivor of countless tragedies, but I am a victim of all of them. When I was younger, I was raped by someone I trusted. I trusted them so much, and I didn't even know what happened. My brain blocked it out for so long because I was traumatized to the point where I forgot. I couldn't get help because I forget. And I knew that based off of how our world is looking, if I spoke up now, nothing would happen and I would never get the help I need. But that doesn't make me any less of a victim. As I got older, I also ended up having an abusive mother who is no longer in the house, no longer a part of the family. However, that did not spare me from her and her quote-unquote wrath for about 5 to 6 years. And the only reason it ended was because my sister took her own life on May 13th. it's been anything but easy going forward from there. I have lost friends. Their parents will treat me like I'm some kind of infection. People do not want their child talking to me because I am traumatized, and they're scared that if they have friends like me, that their kid's gonna end up a horrible person because apparently, because I'm mentally ill, I'm suddenly a monster. Whether it's the mental illness or the fact that I am also an openly queer woman who has been harassed since about 5th grade is anybody's guess. But life hasn't been easy. And despite it all, excuse my language, I've made it my bitch. And I'm going to continue doing that as long as I live because I am sick and tired of being a victim to everything that comes my way. For the longest time after a lot of the tragedy, I became a horrible person doing anything to get control. It came to the point where when I didn't have something in control, I would become depressive, I would become suicidal. I tried to kill myself at least 3 times in the span of like 2 years. That's not normal, that's not healthy. But nowadays, I've gotten the help I need, and I'm still getting the help I need, and I have a much healthier support system. And I am sick and tired of not getting the help I need because for years I did not get that help. For years people did not get that help that I loved and I lost. And sometimes I find myself thinking, if we had started fixing everything sooner, maybe I would still have a sister. Maybe I would actually have a healthy mother, or maybe she would have been removed sooner. Life hasn't been easy, and I'm sure it hasn't been easy for anybody in this room, and I am sick and tired of struggling and watching people I love and people I don't even know struggle because I know what it's like and I know everyone here knows what it's like and I'm done. Change needs to happen and it needs to happen now.
Jason?
It's a tough act to follow. Again, my name's Jason Bazemore. I happen to be Oakley's father. And as she mentioned, on May 13th, 2017, my oldest daughter, her older sister, Hannah, took her own life. We started a foundation called the Hannah Grace Bazemore Foundation, obviously in her namesake, to try to bring awareness to teen mental health, teen suicide prevention, and cyberbullying prevention. We look for as many opportunities as we can within the community to try to be part of things like this tonight. And I think for me, I've done a lot of talking at schools. I talk to groups, kind of twofold. One, I aim towards the kids, one towards the parents. Being a parent on, this group tonight, I can tell you that it's 2 very different talk tracks. And I know we're going to have some questions. We're going to go over it. I think my biggest message to parents, though, is we need to get out of our own way. One of our biggest obstacles is our own egos. We tend to want to know, what does it mean about me as a parent if my child is struggling from mental health or if my child is struggling from anything? The reality is it doesn't mean anything about us. It's about our kids. And the sooner we realize that, I think the sooner it's going to allow us to kind of get out of the way and let them get the help they need, because often we're the last ones that the kids can turn to. Kids often feel like their parents are the last people they can talk to, no matter how close they are. I was incredibly close with my daughter, Hannah. Oakley and I are incredibly close. There are some things that kids just can't come to you with, and as parents, we have to know that's okay.
Awesome. Thank you so much. Thank you again for all of your empowering and brave story sharing. So just a reminder for everyone in the audience, both online and in person, you have like those index cards, or you can message in the chat feature to field any questions that you have. So I'm going to kick us off with some prepared questions, but afterwards we're going to share that space. So this is just a reminder while folks are continuing to share their stories. So I'm going to start questions with Mia. So my question for you, Mia, is what supports are missing for students struggling with anxiety?
I think that there are a lot of supports that schools could be offering more of because, as Oakley was saying, I am really, really tired of me struggling in silence that I did for a while, watching my friends struggle in silence is just draining to look at. But in terms of schools, just to preface, I'm talking about my experiences. I can't speak for any other youth experiences at their schools. But I'm a freshman, so I was in remote learning until about 2 months ago. So I can't really speak on my high school experience that much, but my middle school experience, I noticed a lot of kids didn't really know the difference between guidance counselors and social workers and what they do. Both are extremely crucial to a school system and the mental health system in a school, but I also noticed during my middle school experience that guidance counselors were a lot of the people that were coming to talk to classes and showing what they do, but I didn't see a lot of, not advertising, but social workers kind of saying what they do. And my mom is a social worker, so obviously I knew what they do, but seeing my friends not knowing, I was like, well, social workers can help you. So that kind of goes along with how I feel like maybe adults in schools could be a little bit more proactive about them coming to students, because as a youth person, thinking about going up to someone, especially in my new high school, and being like, hello, Mr. Guidance Counselor that I have never met before, never had a conversation with, and I don't know if I can trust. This is what I'm struggling with. I need help. That is terrifying, at least to me, and I'm sure to a lot of other people. It's really scary to be vulnerable like that to someone that you don't know. So I feel like if mental health professionals and even teachers just kind of did little check-ins, it doesn't have to be a lot, but just being like, hey, you can trust me. I am someone who is here to help you. I want you to be here. I care about you. That would be extremely helpful in school systems. As far as teachers being educated, Legislature recently implemented mandatory trainings for teachers that are about 2 hours a year, which is definitely a small step in the right direction, and that's in suicide prevention. So they will be educated on the signs of teens and youth with suicidal tendencies and that are showing signs of it. And I think that that would be really helpful, but in addition to that, youth listens a lot to other youth. Like, hearing you guys share your stories, it's really inspiring and also makes me feel so not alone in my experiences. So even youth that are trusted in the community to be educated on suicide prevention and signs of suicidal tendencies, and it doesn't even have to be that, signs of teens that are struggling with anxiety, signs of teens that are struggling with OCD, any mental health disorders that students may need help with, or even abuse. I struggled with being mentally abused by someone that I really, really cared about, and it was going on for a really long time, and my mom was there. She witnessed it, and I know that I showed a lot of signs of my PTSD from that, which is hard to say to you guys that I don't know, but I feel like probably if adults were a little bit more proactive in schools and just offered support, I think that that would be really, really helpful for youth struggling.
Awesome. So my next question is for Kaylani. When did you realize that you are not alone?
Well, I realized, there are multiple times when I realized I wasn't alone. Like when my teachers and family and friends would help and make sure I had clothes and food and stuff. And when I saw other kids at the school who had to also get those things. But one thing that happened kind of recently that really sticks out to me is when Bob Thompson came to talk to the cast team about homelessness and really made me realize that I was not alone. He explained what it was like and how living that life was, and how he worked with families and kids to help them who were also homeless, or as he said, in families in transition, because he had hope that he could get them back on their feet and sorry. He had hope he could get them back on their feet and not in transition anymore. So I found that really inspirational.
Awesome. Awesome. We love to hear that. So my next question is for Joshua. So I know that you just shared your story, and what did you learn from your experiences?
Well, I truly learned that your identity does not come from what you achieve or how successful you are in the world. How wealthy, how smart, how you look, or how well known you are does not determine your value. Where I found my identity is in Christ, and my life is filled with hope.
Awesome. And my next question is for Oakley. How can we better educate all school staff members, teachers, support staff, administration, guidance, custodians, cafeteria staff, bus drivers, etc., to recognize the signs and symptoms of someone struggling?
Now, this is a fun one. I'm pretty passionate about this. For those of you in the audience, I know a few of you go to school with me, and I'm sure some of you guys have probably seen me have conversations in the middle of class with teachers that have said something a little bit too ignorant. So, how can we better educate all school staff? Well, bouncing back to what Mia said, ever since COVID, there have been new laws put in place where schools, especially like teachers at least, are required to take 2 hours of suicide prevention training. Now let me ask a question to the audience, just with a show of hands. If you were in a class for 2 hours long, how many of you guys would remember every last thing that was said for the rest of your lives, for the rest of your careers? Exactly. So how does anyone think this is going to help at all? Would you remember a few things? Yeah, probably. It's just 2 hours though, and you never revisit it, or maybe you do like once a year. Will that really help you? No. It's like the equivalent of learning like, hey, this happened once. It's like your friend telling you it's their birthday, because you're going to forget next year. You're going to keep forgetting. So, the 2 hours aren't enough. So what comes next? What can we do? Well, first off, you could always take a look at a study for adults with what helps them learn best and kind of wrap around that. I personally, without having done that research, so I could be coming from a misguided place, but I would honestly call for, first off, common sense of longer hours, more training. 2 hours is not enough whatsoever. Kids' lives are quite literally in your hands, and you're going to tell me that you're going to learn about suicide prevention for 2 hours? Only 2 hours. That's ridiculous if you ask me. I believe it should be at the very least 8 hours. I firmly believe it should be a week-long course. Even if it's just an hour a day. I believe that there should be something that they can be tested on at the end. I believe there should be certificates, because I believe in my heart of hearts, based off of my school experience and the help I have been given, that some of the teachers I have seen are not qualified to help these kids and should not be teaching these kids. There are a lot of teachers I have seen, I have had, or I've seen other people have that are not helpful whatsoever. They're good teachers, don't get me wrong. Horrible when it comes to helping kids, though. And honestly, that's because they never got this training. They're not even to blame. Most of these people have never gotten this training, and they're only trained for suicide prevention. What about the kids with mental health problems? What about recognizing depression? What about recognizing OCD? What about recognizing PTSD? What about how do you help a kid with tics? How do you help a kid that's getting bullied? Simple. You don't know because you're not trained for it. And in my opinion, that's horrible. And most of the teaching only goes to teachers. These programs are only for teachers. So what about the rest of the staff? I ultimately think that, well, obviously there's going to be an issue of how do we afford this? Well, first off, allocate the funds. Funding from schools is often centered around, getting materials or getting materials, honestly. But what about the rest of the funds? They go to building sports fields or for fun activities. You can't have those sports fields if you don't have kids. You can't have those fun activities if you don't have kids. Teachers need to realize, staff needs to realize, school units need to realize that their kids are dying, and these kids are in your care. You need to do better, and you need to get better training. Start allocating the funds for proper training. Look into proper people in proper programs because they are everywhere. They're not that hard to look for, and I know that because I have looked myself. I am writing a paper on this currently for one of my classes. Thank you.
Thank you. So my next prepared question will be for Jason. So what do families need to support their children?
I think families also need education, and it's education on options. Often, as I can tell you personally as a parent who had experienced with my daughter in the past, there really weren't any warning signs. Like I say, we were close. We communicated pretty regularly on a lot of everything. I was kind of mom and dad for a long time, so I had both roles. And outside of one time her telling me, Dad, I think I'm a little anxious. I'd like to talk to somebody. I think I'm not even anxiety. She said, I feel anxious sometimes going to class. That was literally the only thing she told me, and that was maybe 2 months before she chose to take her life. So I think education on the kind of options that are available for mental health, but also warning signs as parents, what to look for. Is my kid staying in their room constantly and not coming out? If so, you're in trouble. What are the warning signs that I could look for? What resources are there that I could look into as a parent if I'm worried about my child, or to try to figure out maybe I should be worried? I think we should all be worried to some extent. At least to just be able to check in. So I think education on options, and I think the next one's going to kind of touch into it, but communication as well. One of the things I see a struggle with is communication amongst different variants within the school and the resources that we have. Guidance, for example, they're not really therapists, but they get a lot put on them, and they do a wonderful job, but there's only so much they can do. And then they're limited on how much information they can pass on to the next source. Even I know Officer Morrow couldn't be here this evening, but law enforcement, one of these juvenile officers goes out and has to handle a call this evening for domestic violence. A kid just had the worst night of their life. There should be some way tomorrow to communicate that to the school so their teachers, the educators, everyone around them knows, hey, they might need a little extra support today, or if they seem out of sorts, there's a reason for that. Right now, those communication pieces aren't really in place. And I know HIPAA protects a lot of safety when it comes to medical, but we have to do a better job at communicating amongst the different channels within the resources that are available for the kids, because when something's happening on this side and we don't know on this side, we can't really expect to put the two together.
Awesome. So the next part of this question is, what are some of the barriers beyond what you just mentioned that families face?
I think really the biggest barrier that families face is the stigma of mental health. Again, what does it mean about me as a dad if my child struggles? Or what does it mean if my kid's a bully, or my kid's getting bullied? What does it say about me? And as parents, it's very hard for us to put our egos down and to put that down. The reality is, it's not about me. It's not about you. It's not about us as parents. It's about our kids. It's about the youth. It's about what they need. And I think something like tonight, giving these kids a voice, and again, I can't tell all of you how proud I am of you, and just blown away at the courage that you have to come up and to talk and to share your stories. I think we need to do a better job as parents, as educators, as administrators, as politicians. We need to do a better job of listening to the youth, giving them a voice. As a parent, I might think I know what my kid needs. I might think I know what other kids need. And I'm probably more connected to that than most because of my experience. But still, without sitting and listening to them, we're not going to know. So getting beyond the stigma of mental health, I think the other part of it is resources. the resources that are available to families, resources that are available to the kids. Look at the cost of insurance right now. Health insurance costs are skyrocketing, and no matter how good of a program you have, I can tell you from personal experience, the mental health coverage of almost any health plan in this state sucks. We've had therapists that we've had to pay out of pocket for because we have such a high deductible and it doesn't cover mental health. We need to look at what we can do to get better mental health coverage included in medical insurance.
Thank you. So next, I'm going to move to Shilu. What is needed to support children or young adults in our schools?
Thanks. Yeah, that's a complicated question to some degree, but I'll try to be succinct in my answer. I think the number one thing that would be helpful is really decreasing the stigma that's associated with mental health. Nobody has a problem if a young person has to run down and speak to the nurse because they bumped their arm or needed a Band-Aid. You know, nobody kind of looks twice if somebody goes to the nurse's office. However, in many schools, social workers or mental health professionals, if you're lucky enough to have them in schools, are kind of down a hidden little hallway, and kids are like, don't talk to me in the hallway. People might know that I see you. You know, and we really want to take that piece away and make it a more open conversation within the school, with teachers, with parents. The other piece that I would say that kind of goes along with that is I work for SAU 39, which is Sauhegan High School, Amherst, Mount Vernon area. And I'm very lucky that mental health is quite valued in our school district. We have social workers in all of our schools. And so we have the ability to see kids. I'm not splitting myself between a bunch of schools. But I'm in a social work cohort with the state, and that's not the case in many places. So I think really pushing on those who are able to make decisions for our state around implementing some policy to have more social workers in schools available to young people of all ages. In my previous life, I was the director of a residential care facility in Nashua for many years. I was there for 20 years, and there were a lot of supports in the community. And so the need for having people in schools was still present, but definitely less so than it is now. The number of facilities that have closed over the time that I've been working in the southern New Hampshire area is astonishing to me, in fact. I have young people who I need to send to the emergency room to have an assessment, and there is one place for young people under 18 in New Hampshire to be hospitalized if there is a safety issue. One. I will give you the most updated numbers. As of yesterday, there was a young lady who needed to be taken into that level of acute care, but she was 30th on the wait list for young people under 18. So she needed to go home and be with her parents. And not that her parents aren't wonderful people, but if you meet the level of care for hospitalization, you should be able to get that kind of care. If somebody were having a heart attack, they wouldn't say, why don't you go home and wait it out until the 30 other people can get in before you. So really leveling that playing field with mental health and physical health. And then the other piece is also training for staff, and we've heard that discussed. The 2 hours is a step in the right direction, but I really think it's important for our teachers who are face-to-face with our students every day. When we talk about risk factors and protective factors as it relates to mental health, school falls in both, because school can be a stressful place, but it's also a really good place that we are seeing young people every single day. So we need to teach our teachers, our administrators, our superintendents, our coaches, what to look for, and then who to connect them to. So I think maybe not as succinct as I thought it was going to be, but those are my thoughts on what we could do in schools.
I would clap, but you guys would hear it echo throughout the entire room. So this is just a reminder before I go on to our last two prepared questions. If you have any questions and you're in person, you can write it on your index card and hold it on up, and Melissa or someone else wearing a purple polo shirt can come grab it, and I'll field those after we finish these two. Okay, so the next question will be for Molly. Can you share what the Office of Social and Emotional Wellness is doing to support mental health in schools and what's needed to further the department's efforts?
Sure, thank you. So I'm Molly. I stated earlier, I'm from the New Hampshire Department of Education. I specifically work in the Office of Social and Emotional Wellness. And my job is to provide direct technical assistance to districts and to schools. So what we're doing at the office is we push into schools to support them building a tiered prevention framework. We follow the system of care values, which align with trauma responsive programs. We value and favor youth and family voice, and we promote things like universal screening, so we know 100% of students are being looked at, and students are less likely to fall through the cracks. Those are kind of the values, and what we implement is what's called Mtssb. That stands for a multi-tiered system of support for behavioral health and wellness. And within that system, we focus on social emotional learning for all students. We focus on a tiered prevention framework, and we do that through an integrated delivery system. So what we do is promote the schools and the communities to come together, work with their local community mental health agencies and other programs and organizations to build up their capacity to support behavioral health and wellness for all students. And of course, all of this focuses on student outcomes. We don't just look at access to these programs, but we look at the data to ensure that what we're doing is actually having an impact for our students. There are some posters outside. I know what I said can be kind of nebulous, but I'm happy to talk with anybody about it further. The second part of your question, what could we do to kind of move the work forward? And I would just promote the office as much as possible. We have a pretty big social media presence, which I know is unusual for a Department of Education, but we often put out funding for the districts and the schools to help implement these systems, to pay for teacher professional development and all those other types of kind of nitty-gritty that goes into it. So if you are willing to follow us on Facebook, or Twitter, or YouTube, we kind of put all of this out there just to get the word out, and we promote all these other programs like New Futures and stuff as well.
Awesome. Yeah, clap, go ahead. It's an important conversation to have. This is exciting. Okay, so my final prepared question will be for Deli. How can our legislatures move the needle towards progress on the mental health crisis in New Hampshire?
Oh, thank you, everybody. So in 2016, the legislature passed a law, and the governor signed it. It's called the System of Care Law. It's RSA 135F. And it had 3 values in it. And the values were, if we're going to talk about kids and make decisions about kids, they need to be at the table. So nothing about us without us. The second one was that the things that we do for kids, we will make sure that they're culturally and linguistically competent so that we're meeting the needs of all of our students. And the third one said, we will build out our community-based system. The goal is not to institutionalize children. We know kids do better when they can stay in their homes and in their communities. So we do not want to put them in hospitals. We do not want to put them in waiting rooms, waiting, days for a bed. And we don't want them to end up at the Sununu Youth Services Center. So those were the 3. We have started to build out the system since 2016. But we do know it takes years to build out this system, and it takes financial support as well. In 2019, we added to 135F, and that was called Senate Bill 14, and that strengthened even further the System of Care law. And that law added a fourth value. It said, if you're going to work with kids, then you need to become trauma informed. Because we know that there are two ways kids acquire mental illness. They can be born with it, or they can have experienced some tragedy or trauma, or like you heard, things that happen in their life that cause them to, suffer from a mental illness. So we want our educators and anybody that works with children to become trauma informed. What we really want is them to be trauma responsive, but we'll get there. The first step is they have to understand trauma and how to work with kids that have trauma. So 4 values in the system of care law. That's very exciting. One of the other provisions in Senate Bill 14, there were 12 provisions to build out the system of care law, said we will go to the child. We will offer statewide mobile crisis to kids. So instead of pulling a kid out of school or out of their home and bringing them to the emergency room, we will actually have a clinician and probably a peer support person go to the child's home or the child's school. That was signed into law June 3rd, 2019. We have yet to see children's mobile crisis happening in our state. We keep hearing it's going to happen. We have yet to see it happen. We allocated, or the legislature allocated $20 million for that to happen, so the funding is there. I recently heard that the Department of Health and Human Services has asked for another $5 million, and I've heard that that's been placed into the Senate budget. So we need to make sure that's in there. We need to make sure that the House passes that also. These next couple of weeks are going to be very interesting, people. They need to hear from you. Our legislators are not all-knowing people. They need to hear from the constituents. They need to hear these stories. What do you need? Well, we need mobile crisis. Sadly, my son tried to take his life 12 years ago in his middle school. He has schizoaffective disorder. And there was no mobile crisis. So they called the police, and the police came and handcuffed my son in front of 1,100 other kids and walked him out and put him in the back of a police car. This is not how we should be treating our children. If we had had mobile crisis, somebody could have come to the school and helped my son calm down and hopefully stay in school and finish his day. We know mobile crisis works. We've seen it working in other states. So we need to get this implemented, but we need to make sure there are funds every year in our budget so that we can sustain mobile crisis. This would be a really big improvement to our system of care to helping children. I know we have a workforce shortage in New Hampshire. One of the things we've been asking for is the student loan repayment program that would allow clinicians to be able to stay and work in New Hampshire without paying back their hefty student loans. The state would help them with that, and we could keep clinicians in the state. That's a huge problem we have in New Hampshire. That's why we have so many waiting lists. That's why we have, I just found out 13 days, a friend of mine's son was in the waiting room at Concord Hospital 2 weeks ago. So if we had more clinicians, if we had the student loan repayment program, we could have more people in the state. I did want to talk about Mtssb. That's the multi-tiered system. That is a federally funded program. The state has not made an investment in Mtssb. We filed a bill last year that asked the state to please invest in Mtssb statewide so that all schools could have it. Right now, just some schools use Mtssb, and it's an evidence-based program. And the state, the legislature passed Mtssb saying, yes, we believe in this program. We know our governor loves the program. And we asked for $5 million to help us get the program started throughout the state, and we got $1. So if we want these programs to be utilized throughout the state, we do need some funding. But they need to hear from you. They need you to tell them you want them to prioritize these programs. We have another program called Child-Parent Psychotherapy. You have a folder. There's information in there about that. That would be an incredible program to to get to kids and help them with prevention and early intervention. But we have not made any state investment in child-parent psychotherapy. We have to prioritize these kids, but I hate to keep saying this, they have to hear from you. So if you need help talking to your legislators, please reach out to New Futures. We will help you do that. We would be honored to help you do that. So one last thing, 2 years ago, we had a youth summit. We got 400 kids together in a room. We spent a whole day talking to them about mental health. What do you need? And the overwhelming response from these kids was, we need more social workers in our schools. The school counselors aren't getting it done for us. They try their best, but we need social workers. Overwhelmingly, that's what we heard. We haven't done a thing about it since that 2 year ago conversation. So thank you, everybody. Glad you could be here.
Awesome. So those were the prepared questions, and I just wanted to thank everyone again because those were some powerful, powerful answers. Yes. So also, if you have already used your index card, I'm sure there's someone around you that probably also has an extra one. And we are still fielding questions, so if you have written something down, someone will still come grab it for you and eventually bring it up to me. So I do actually have a gazillion questions for you all. Some of them are specifically for certain people. So I actually have, the first question is just for Sheila. Can you speak to the best practice ratios between counselors and LCSWs?
Yes. In schools specifically, it doesn't, is the person in person? I can ask
Yes.
a clarifying question.
The person is in person, yes.
Can I ask a clarifying question? Yes. Hi. Sure. So specifically at Sohegan High School, we are lucky that our school counselor numbers are slightly better than other schools. My daughter is at Nashua High, and they have hundreds and hundreds of children on their caseload, so they don't get to know them or can spend any time with them. I think the model that I would say is to be able to have school counselors be trained in some type of mental health counseling or some mental health background so that they can be kind of the first line of defense. We have tiered interventions that we use in schools. So as a tier 1 intervention for school counselors to be able to respond to students' needs and then be able to make an appropriate referral within the school to a school social worker. It's hard for me to talk about what best practice is in terms of where numbers should be right now because we are really being inundated, particularly because of the COVID pandemic. Our numbers are really through the roof right now. I had some students, we have 9th graders who are supposed to write a proposal to make Sohegan a better place. And I had some students come talk to me and say, what can we do to make sure that we have more mental health services at our school? And they said, how many kids do you see a day? And I kind of started counting and I said, wow, like 12? And they said, how many hours are there in a day? You know, but that's kind of how we're all going at this pace right now. So I would just say more time to be more out into the areas of the school, social workers and counselors, so that we can do what Mia was saying, which is to go out and find students and say, hey, what do you need? How can I help you? I think we prevent larger issues from happening if we can kind of nip them in the bud or provide us support right away.
Awesome. Thank you so much. Yeah. Woo. So the next question is for Jason. What type of mental health workplace supports do you think are needed or do you see that are needed?
Workplace?
Yes. That is.
I guess it depends on the workplace. As far as our conversation tonight, I think has been geared towards school. I think having counselors in the school is amazing, and I know a lot of schools don't have that option. So I think it should be an absolute necessity that every school has counselors available. And again, we talked about the guidance counselors being, like you say, that first phase, the first line of defense. Their training is going to be limited, and no matter how wonderful they are, and we've had some wonderful ones that we've worked with, there needs to be help beyond that. So having counselors in the school, and again, I would bring it back to the communication piece, making sure that everybody is able to share the pertinent information about a child who might be in need or might be at risk. So everyone's connected and you're able to connect the dots with each kid. I think that's a really important part of things get lost in translation or things that slip through the cracks. So if we're communicating about one student, but you don't know about the student, we don't all know, we're not all part of what's happening or what the plan is, what the program is, or maybe what that child's going through. Finding some way that we can break through some of the communication barriers and making sure that we're all on the same page.
Awesome. So, this next question is actually for anyone who wants to answer it, so it doesn't just need to be one of you. So what types of peer support, in addition to Community Action for Safe Teens or the Youth Empowerment and Service Team, would you like to see in your school or communities? So peer support groups or ideas for support systems. They're community-oriented. Anyone can take a stab at this one. It's a tough one. I'll give you a second.
Can I just speak to that for 1 second? We in our school have worked with NAMI New Hampshire to implement a Connect program, which is exactly what it sounds like. We have youth who are trained to go into classrooms, speak to students about ways that they can get help within their school, give information about mental health, mental wellness, and then they work with the student. Then a student can go to them and say, hey, Mia, I saw you come present in my class and I'm struggling. Mia would not be responsible for helping that student get better, be their counselor or anything like that, but she would be responsible then to say, great, I know somebody in student services who I can bring you to. Do you want me to come with you? Do you want me to sit with you? Do you just want me to let that person know? So it's really connecting youth to youth with adults that can help.
Awesome. Sarah, go ahead.
So I also have some thoughts on this based off of something that actually happened in my school. I'm forgetting what it was called. I know a few people in this room go to the same school, and I know some of them partook in this, so they'll probably remember the name. I'll probably remember it tonight, like after. The second I leave the building, I bet I'm going to remember. I actually think, Riley, do you know it? Was it Challenge Day? Yeah, was that what it was when everyone is going into the gym? Yes. All right, perfect. So it's called Challenge Day. And what it was that a bunch of kids signed up for it, and they were doing mental health activities and breaking the stigma and breaking the barrier between them. They took the whole day of school to grieve, learn about each other, and heal together. For example, there was an activity, and correct me if I'm wrong, I wasn't able to attend, unfortunately, but there was an activity where they would have, I believe it was 2 students stand across from each other. Or maybe it was something about students in a line, and cross the line, thank you. And they would give you prompts, questions based off of experiences. For example, if someone in your house struggles from addiction, take a step, stuff like that. And they started off small. They actually started off with really easy questions like, if your favorite color is this, and so on. But it eventually descended into those more serious topics. It was a steady flow. That steady flow is vital for kids. A lot of us are terrified to share things. Like, mortified. The fact that I'm up here sharing a lot of stuff took a lot of time and a lot of therapy and a lot of preparation. A lot of kids just don't like speaking about this stuff, and to an extent, it's because they're scared they're going to be judged for it. I think activities like Challenge Day are vital for breaking that barrier because, like my dad had said earlier, there are some things we just can't go to our parents for. And sometimes nobody gets us better than the people we see every day, our peers. And you never know. Maybe someone that you don't even like could be struggling with the same thing you are. And I think those opportunities to meet people, especially after COVID, because let's be real, how many of us have really left the house that often? Not a lot of us. I wish I could be raising my hand. I wish. But a lot of us are lacking that social interaction that we used to have. A lot of us need to reconnect again. And I think things like Challenge Day are a really good opportunity to get communities to interact with each other and heal. And going back to, I don't remember who it was, I'm so sorry, my memory is absolutely horrible. But not only does it help break the barrier, it helps you realize you're not alone. Because a lot of us, even if we hear everyone's stories today, a lot of us will go home feeling like we're alone still. Let's be honest. And I don't want anyone to feel that way ever again.
Is there anyone else that wanted to add anything? Yeah.
Like one really quick thing. So particularly at my school, it kind of sounds a little bit dumb, but it actually only takes one person at my school to start a club. Like you could be in a club by yourself and be after school and do the activity. Like it seriously doesn't matter. So even having like a little club of like 1 or 2 or 3 people, just being able to share their stories, and then they go tell their friends, and then they go tell their friends, and their friends tell their friends about all of this, and just this like safe space that, this sounds really bad, no offense to all the adults in the room, but it has no adults, it has youth, just people that are gonna relate to each other and relate to their experiences. And so I've been thinking about this a lot, actually, and I did discuss it with a couple of my friends, just talking about this. So probably next year we might suggest something, but I don't know. I feel like that could be really helpful in a lot of schools. So if your school has like a spot that you can meet after school, that would be really beneficial to a lot of people.
Good idea.
Go ahead.
Wanted to let you know about a new nonprofit that started in New Hampshire maybe 2 years ago called Safe Schools. It's being run by a man named Mark Phillips. He's doing a pilot program starting this fall with 3 school districts. I believe it's Kearsarge, Lebanon, and actually the private school district, Proctor Academy. And they're going to create peer support programs throughout the school year and see how that goes. We do know that's how people get well. We know medication and psychotherapy are right up there, but peer support has been shown to help people go into recovery. You never get cured of your mental illness, but you can go into recovery. So he is piloting this program. So I encourage you to check out his website, Safe Schools. I think it might even be safeschoolsnewhampshire.org. And we have some exciting things coming with that peer support program being added. So I'm encouraged by that.
Awesome. Okay, so going off of that, we actually have a webinar question. I don't know what it means, but that's probably because I'm a child. So does ESSA funding qualify for any or all of these initiatives that we just talked about? I don't know who that would be directed to because it doesn't specify.
ESSA funding will cover some of the training costs. It depends on how schools are allocating their funding, but it can cover social emotional learning and the curriculum and training.
Awesome. So I have another question for you, actually, Molly. This one's not from the webinar. So who decides which school districts implement Mtssb?
That's a great question. So school districts reach out to us. We do have some outreach. Like I said, our social media, we're a pretty new office. I've been there for about a year. I started about 2 days before the pandemic hit. So we haven't been able to have that on the ground sort of interaction with districts and schools. But they reach out to us. We have some contacting us on our website. Our phone numbers and emails are all publicly facing right there. So yeah, they contact us and we do our best to support. Right now we have 3 consultants to cover the south part of the state. I'm Southwest. I have a colleague in South Central and Southeast, and we're looking to expand 2 more to cover Lakes and North Country. But yeah, any district can reach out.
So my next question is for Mia. The person also wanted to add, great point for speaking about guidance counselors when entering high school, because that's definitely,
Thank you.
yeah. So the question on here is, any ideas on how counselors can better get to know their students early on in high school?
Yeah, so, okay, so I know that at my mom's school, she does this thing that I think that you, Josh, did, the Sabre Startup, and it's for 8th graders that are coming up to 9th grade. So my school doesn't do that. I would love if my school did that, but we don't. But that gives students that are new to the district or students that just need a little bit extra support. It gives them that opportunity to get to know other kids, other teachers. My mom's there, so they get to know a social worker there. But I think that at my school, personally, I think that just coming into classrooms, because so at my school we have an E-block, which is basically a free period. It's like a study hall. You can go and meet with teachers, and you can go ask for extra help. Just getting a specific time where a guidance counselor or a social worker could just come into every E-block and just kind of introduce themselves, say, hi, I'm on your side, I want you here, I care about you, I'm always here to talk to you. Because I'm sure that no teachers want to hear that their students are struggling, but they also aren't taking the steps to reach out to find out if they are or not. So I think that just teachers putting themselves out there, counselors putting themselves out there to just go into one classroom for maybe 10 minutes and just say, I'm here if you need me. No matter what, there's no judgment. It's a safe space.
Awesome. So my next question, yeah. I'll just positively react every time I hear someone start clapping because okay. So my next question is directed towards Joshua and Kaylani. So either one of you or both of you can take a stab at this question. So would it be beneficial to have community partners come into schools and provide a non-judgmental space for students to talk about managing these intense feelings that we've been talking about today? So if so, what would you like that to look like? You can take a sec, because that is a multi-part question. Which one of you wants to go first?
I'm sorry, could you repeat the question?
Yeah, totally. So, do you think that it would be beneficial to have community partners come into schools to talk about managing these feelings? That's the first part of the question. I'll ask that part first. Do you think so?
I'd say so, yes. And because I know personally for me, I tend to bottle up my emotions, and I have a lot of thoughts, and I guess if I tend to store up things too much, it becomes overwhelming. So I think definitely a space to share out and open up is definitely beneficial.
Do you agree, Kaylani? Yeah. So I know that you talked about one of the things that resonated with you, Kaylani, is having someone come in and talk to the YES team about some things that you related to. Do you think that it should take that format at school, or do you think it should look a little bit different than that? And also, Josh, you can answer this question as well, but do you think it should take a format similar to what you experienced there, or anything that you would change? It's okay.
Yes. I think that when Bob Thompson came in, it was very beneficial. And I feel like when he talked about families in transition, a lot of people didn't know what that looked like. They knew kind of stereotypes of being homeless, and they didn't know it's not just living on the street or something. It's more bouncing around from home to home, and just not having one place to say this is mine. So I think that, spreading more awareness and maybe having people that have more experience with it and talking with youth and would be very beneficial.
Awesome. So what I just heard from both of you is that, and also throughout this entire night, is like we have to address stigma, whether it's associated with folks who have insecure housing or mental health awareness. We just want to make sure that we are providing care to folks or support and information that is accurate and destigmatizing. So, another webinar question. There's actually a lot of webinar questions. So some states have passed laws mandating health insurance coverage for mental health services, and mental health would be covered the same way that physical health is covered. What is the current status of how mental health parity in New Hampshire is? I know that we touched on that. A couple of us have talked about how mental health is treated in relation to physical health, but anyone can kind of take a stab at this one.
I'll just say that the CEO and President and CEO, Michelle Merritt of New Futures, has been working with an ad hoc committee of folks to address this issue, and they are deep in the weeds. We know in New Hampshire that needs to change, so I would say keep your eyes and ears out. It is being worked on as we speak.
Yeah, good. Is there anyone else that wants to try that question? If not, that's okay, because there's actually a second part to this question. No? Okay. So the next question that this person asked is slightly different. So what do you think or have observed is the prevalence of eating disorders among students, and what services are available? This can go to anyone.
I will answer that question. I definitely think I have seen an increase in eating disorders and a decrease in substantive treatment in our community for it. So it's pretty difficult to be able to find. Eating disorders is a very specific track of treatment that young people, adults need to take, and so finding people who are really skilled in that arena has been pretty tough. We certainly try to address it at the school level. Again, like I said, there are many of us who work in schools who see students every day, so we can see a change oftentimes before sometimes somebody else might see the change, and so it's important to be able to have resources kind of at our fingertips to be able to make sure kids are getting what they need.
I saw a couple of you lean forward when I asked that question. Does anyone else want to take a stab at it? Kids are also, or young people are also allowed to. Did you want to? Okay, go ahead. I saw you.
So, as someone who has an interesting amount of experience with this, when it comes to eating disorders, the place where it stems from varies. There are a plethora of factors that can affect it. Some of the dominant ones that come to mind are social media, obviously, which is something we can't really mandate. That's more so a matter of the only way I can think of to combat it is honestly breaking a stigma. There's been an uprise in body positivity, and it's been helpful. But I feel like there's something we're missing, and I don't know what that something is, but I'm hoping that one day we find it. And a big factor that I'm also thinking of would be the upbringing of a lot of kids. Some of us were told that, oh, you're eating too much, or oh, that's a little less food than you normally eat, you're gonna be skin and bones, or saying, oh, if you have another serving, you're gonna start putting on a lot of pounds. I started hearing this when I was like 9. 9-year-olds don't need to hear that at all. We're kids. We're supposed to be eating food. We're growing. When it comes to where eating disorders stem from, like I said, it really varies, but some of it also comes from our peers. It can come from schools, funny enough. This is going to be a little cold, but be there any teachers in this room, we know teachers talk, and we hear that teachers talk. We overhear everything, just as you overhear everything we say. I have heard teachers and people in authority make vile comments about their students, and they mean so much to us because we look up to you. Always be mindful about what you say. The world is not a nice place, I'm going to be honest. A lot of people aren't that nice, especially with their initial judgments. And eating disorders, especially when it comes to kids, because we are vulnerable, we are looking for an influence. We don't know where we're going. We're kids. We're naturally going to look to adults. We're like, hey, help. You look like you got this figured out. Help. Help, please. And if you turn to us and say, oh, that's too much, or oh, that's not enough, we're going to think, okay, we need to eat a lot less or eat a lot more. And that's also to get into the other category of kids that are already mentally ill. There's this thing that some mentally ill kids will have called rejection, I think it's called RSD, rejection sensitivity dysphoria. Thank you. Thank you, brain. Basically, if you say something like, oh, that's way too much food, we're going to take it as we need to stop eating. There is not many ways to combat that other than reassurance, which is something we need to see a lot more of nowadays, honestly. But it's difficult because eating disorders are such a tricky and diverse type of subject, and the place they stem from, as scary as it sounds, is everywhere. And honestly, what we can do to help is, it's that communication, it's that community, it's that stigma. They stem from so many places, and even places that we don't expect, like schools, what we've been focusing on almost the whole night. If we don't have a safe place to confide in others about how we're worried about our eating, about how people make us worry about our eating, like, oh, I don't know, a guidance counselor or a social worker? How do you expect us to get help for that? Especially if we're hearing this from our parents or people we look up to. Who do we turn to for help? Because those were supposed to be the people we go to for help. Eating disorders stem from everywhere, so that means we also need to have that help everywhere. Yes, especially schools.
So before we move on to the next question, I just wanted to provide my 2 cents on that question because that is something near and dear to my heart, as I have a couple of friends and myself who have been in eating disorder treatment in the past. And I think something I wanted to share, because I know that there's representatives and healthcare workers in the audience today. I think part of things that youth face have to do with the diagnosis of the actual disorder, because the boxes that you have to be put in to be like labeled as someone with an eating disorder are very, very tiny, and typically are only assigned to female folks. So like anorexia and bulimia and like all of those specific eating disorders have like actual, I guess like diagnosable, I guess, statistics that you have to fit into. And I guess where schools or support systems would come in would be to notice that just because someone just because someone weighs like 125 doesn't mean that like they're not struggling with something like anorexia. There's like, I don't know, I feel like that's something that needs to be addressed, but I just wanted to put that out there and know that when I do wrap us up eventually, that all of us will be around for a little bit to answer any questions, and that is definitely something that I would be very open to be asked about. So my next question is for anyone in this group that spoke specifically about their journey with mental illness or a specific diagnosis. Someone asked do you believe that your mental illness was preventable? And if so, what services would have been helpful in that prevention? So, anyone?
So, speaking towards my anxiety, my last doctor's appointment, I was officially diagnosed with generalized anxiety disorder. I've struggled with anxiety for a while. Like, I don't really remember when I wasn't very anxious. But personally, I don't think that my anxiety was that preventable because you really can't control when you get anxiety over things. I don't want to say irrational, but some of the things that you do have anxiety about are a little bit irrational when you really narrow it down and try to think about it when you're not in your head about it. So that specific diagnosis that I did get, I don't think that it was that preventable. I did have a really good support system. I am extremely lucky that my mother is trained in mental health, because if I did not have someone that I always knew was in my corner with my anxiety, I really don't know where I would be in my journey today. So no, I do not think that my anxiety was that preventable.
Also, your mother may have given you some genes toward anxiety. Sorry, kid.
Y'all look like you want to say something.
I want to make sure everyone else has spoken to it, because I know I've spoken a little bit more tonight. Josh, all right. I'm going to come from the other perspective, because
Obviously, some of them are not preventable, like Mia said. Some of them can be genetic, some of them just aren't preventable in general. Some of them, however, are. For example, PTSD. That could have been prevented. The things that caused it could have been prevented. It just circles back to suicide prevention, especially with what my father and I have been through. Had something have happened to make her stay, there's probably a pretty big chance we, for lack of a better word, wouldn't be as messed up as we are. There are some things that definitely can't be preventable. For example, my tics. I've had them since I was about, what would you say, 7? Yeah, like about 7. So when I was young, very young, they just kind of started happening. That's not really something you can prevent, but some things you really can. And a lot of it just boils back down to that support, that prevention. Some things will never be prevented, but people need to start acknowledging that some things can be, and we need to act before they happen.
Did you want to take a stab at it?
Yeah,
Go ahead.
a little bit. I feel like mine could have been, I don't know if it could have been totally prevented, but I feel like it didn't start with, just me developing it. I feel like sorry, just processing. So my mother is also bipolar and stuff, and I feel like she has a hard time using social media and stuff in a healthy way and getting healthier relationships, and I feel like that she needed a lot of help and support on her side, and maybe that could have helped our situation, and we could have built like a healthy kind of communication to get us in a healthier path.
Awesome. Did anyone else want to speak on that question? If not, that's okay. Okay. Yeah. So, yes. Oakley, you got a lot of fans for your outfit today. Someone did ask if you feel comfortable answering this.
Probably.
What does it mean to have tics?
Ooh, that's a good question. One word, an annoyance. That was 2. Oh God, annoyance. That's 1. ticks aren't that bad. They're actually not as interruptive as you'd think. That's also because I've just kind of learned to live with them. I'm sure you've probably been seeing me ticking up here the whole night. I'm just glad I haven't had any vocal ones yet. I'm going to jinx it, but you know. They're annoying, but they're not as interruptive, at least while I'm home. I've been remote for about like a year now, so things really aren't that bad because my camera's turned off. I'm muted. I don't really disrupt the class because it's just me. What am I gonna do? Scare my cat? Yes, actually, a lot. Serves him right, he scares me. But in public, it can be a very big nuisance. There have been instances where I've had to leave stores. I've had to wait in the car because I have been ticking and I was scared that I would have a vocal one or I was having vocal ones and I needed to leave because there have been times where I was nearly kicked out for something I couldn't control. Because people just aren't aware of it. It's not something that's talked about nearly as often. I mean, I'm the kind of person that you look at and you're like, she doesn't have tics. I mean, a lot of people, nobody really looks like it. There technically is no specific image for someone to feel, for someone that has tics. So if you saw me and you saw me start ticking, you probably, especially if you didn't know what Tourette's was or weren't too well informed on it, you'd probably be like, what the hell is that child doing in this goddamn Walmart? You'd be pretty confused. You'd be pretty concerned. It's a really big nuisance though. Living with tics isn't the worst thing in the world until you fling your chopsticks behind you halfway through the kitchen. There have been times where I've thrown things and hit people and I've like accidentally yelled profanities, so it can definitely be a big nuisance, but a lot of them aren't that bad. Like the worst thing that happens on average is I get whiplash from myself. But yeah, it's an annoyance, but it is one that I can actually tolerate pretty well. Some people can't. Some people are actually very distressed by it, especially when you get older and you're in a workplace. For example, I know discrimination in the workplace isn't really allowed, but let's be real, it happens anyway, a lot. There have been several jobs where I just haven't been able to apply because I know I can never fill the position with my tics, and it gets very difficult. But ultimately, for myself, and I'm not speaking for anyone else because I know a lot of people have different experiences with tics, it's not the worst thing in the world, sort of, kind of, maybe, but, you know, tics are tics, and they're kind of annoying.
Okay, so before we get to the wrapping up section, Officer Will was going to be here, and now that he is not, we actually have his testimony that will probably be emailed to anyone who's going to get the recording, but I can read off some of it now. So one of the questions that we were going to ask him was, what is stopping people from getting the help that they need? So what he said was, one of the major issues that people face, especially in a smaller community as Milford, is the lack of local resources. It's not always easy for our young people to access counseling, as most outsource to the greater Nashua/Manchester region, as there's more options out there. So with that comes issues with transportation. If a family is limited in vehicles, it's often the choice between counseling and being able to work or provide for the family, and counseling usually is not the top choice. So the biggest thing that stops people from getting help is ourselves. The fears of being labeled as damaged, crazy, or unstable are the biggest barriers to climb. So he wanted to put himself out there, and he said, I go to a counselor to talk about the things I've experienced as a police officer, as well as events that I've experienced in my own life. I felt all of those fears being labeled, but guess what? None of the fears I had going to counseling came to be, and I'm a better person for it. So Officer Will was definitely talking about things that we discussed this evening about stigma and about creating a space within both yourself and the community where we understand that a diagnosis or a struggle is not defining of who you are as a person. And then the other question we were going to ask was, what are the missing links that we have in our community? And he said, what many do not know is that in-home services do not exist They do exist, and they are available. The major issue is that no one knows that they exist. Fun fact, I just learned they existed 2 seconds ago when I read that. Many of the in-home services are not advertised in the way that the average person would know where to look, and often are only introduced by school social workers if the child is accessing in-school supports. And I know we talked about this earlier, not everyone has access to their social worker in the way that they do, or the way that they need. So that can definitely be expedited by Will's question. So before I say my closing statements, Oakley offered some closing statements before me, so go ahead.
So I mainly wanted to close it off in regards to the youth and give my final words on everything we've talked about tonight, because this was a lot for all of us to hear and discuss. I'm sure a lot of us are still kind of like, oh my God, I feel like I have whiplash hearing everything. I feel like that too. I have ADHD. Welcome to my world. That's every day. But I wanted to kind of center back to the root of tonight. Everyone in this room has struggled with something or some things, one way or another. And not all of us were able to get the help that we need. And some of us still aren't. And some of us have, and that is a privilege. It shouldn't be a privilege. It should be a basic human right. That should be something that, thank you, that should be something that everyone is allowed to get no matter what, from birth, a God-given right, if you will. And there was one last thing that I really wanted to nail into the ground. And for this one, I'm actually gonna get up. So there was one thing that I wanted to make everyone aware. I just want to first say, can everyone hear me? I know I'm projecting. I'm a theater kid. I'm hoping you guys can hear me. I've been doing this for years. So, let's be real. A lot of us here are here for a reason. A lot of us here, adults, kids, students, professionals. Some of us are just here to support family though. Everyone in this room has a story. Everyone in this room has been through their own hardships. And can I just take 1 second? In the audience and here today, can I have everyone that is a minor, every youth, stand up? Every single person that is you, stand up if you want, if you're comfortable with it, of course. Everyone's standing up, okay? Okay, great. To the adults in this room, look around. Look at these children. All of us have gone through hardships. All of us have our own stories. Talk to us and learn them. Because if you want to help us, you need to talk to us. You cannot guess what we need based off of observing us. We're not animals. We're people and we have stories, and you need to start asking them. You are the adults, and this is what you see. Everyone in the audience and the kids here tonight, we are the youth, and this is what we experience. And that speaks so much louder than anything you could ever observe from us. Talk to us and learn our stories. You are the adults. This is, in this room, what you see. This is what you hear. But you will never know what goes on in our minds. Because we are the youth. You see it, we live it. Okay, chills. Okay. So before we totally wrap up, I just wanted to make a thank you to all of the representatives and honestly anyone that is in the audience today, both on the webinar and in person. Personally, I just wanted to thank everyone because I am so sick of waiting and not seeing action for all of the things that have happened to the people on the stage today, and honestly anyone in the audience. I am so thankful that you are taking a stand and actually listening to our young people. So thank you for that. You can pat yourself on the back for that one. Yes, yeah, that's awesome. Thank you. And I also wanted to thank Granite Town Media for helping us produce this event tonight and making the content available for anyone who wasn't able to be here in person, because obviously COVID has caused some troubles with traveling and stuff. So I would like to give them a round of applause. So thank you so much.
And lastly, but definitely not least, I wanted to thank every single one of the panel participants because you have been so candid and brave, and I'm so thankful for all of you for being here today and sharing your stories, and again, literal chills from every single one of you talking, and I'm incredibly grateful to help facilitate all of your stories, and yeah, give yourself a round of applause for that. And as we're wrapping up, just know that a lot of us are going to be here and around. So if you have any questions more specifically for us, you can come ask us. And also there's art all along the front stage here that you can definitely appreciate. I know that, Mia, you have...
Is that little airplane thing right back there. And if I could add like one thing, excuse my language, but my little sheet that has my talking points says, yeah, we killed this shit, and yeah, we killed this shit.
So proud of you. So yeah, enjoy the art and ask us any questions you have, but thank you so much for coming. Thank you.